So we had 20 days and six visits to get her knee from 15 degrees of flexion to at least a neutral position before she went in for an ACL reconstruction. So here are some of the things that we did to make that happen. Okay, so Abby found me on Google and I saw her 2 months after her ski injury. And by that time, she had seen an orthopedic and figured out she had a full ACL tear and a meniscus tear. If you're in a similar situation and you're watching this video, please refer to your own physical therapist to ascertain that these exercises are appropriate for you. Okay, so now let's talk about the exercises. During her first visit, she took 3 exercises at home that I wanted to share with you. The first exercise was pretty much straightforward. I had her lay on her back, rolled a towel, and then propped it underneath her ankle, and then held the knee there for about 5 to 10 minutes a couple of times a day, maybe in the morning and then at night. And then if she had the time, she was always encouraged to try to do it in the afternoon as well. I like this exercise for a couple of reasons. Well, the first is more clinical to her. I like it because it allows gravity to take hold of her knee and to gradually bring the knee down over a span of time. So that's the main reason why I had her do this exercise. The second reason was more so because we had time. It gave us time to chat a bit. And this is more important for me because this is where it gives me the opportunity to understand who I'm working with and some of the psychological barriers in terms of their expectation and their fears and their motivation. And this all helps me come up with a program that fits her appropriately. Now for the second exercise, during her first visit, I had her hop on a stationary bike because she had access to those at home. Since our focus was on trying to get as much knee extension back as much as possible, I only had her focus on the downstroke pattern while she was on the stationary bike. So to get that left knee extension back, I had her left leg pedal at the bottom position and then her right leg at the top position as best as possible. And I just had her rotate the knee forward and back, or the left pedal a little bit forward and then back. I'm not looking for flexion here. I'm just trying to facilitate as much extension as possible. So the downstroke pattern was more important to me, to try to get as much extension. When she got the pattern down here, I asked her to just spend about 15 to 20 minutes a day on here for me. So now this exercise was important for 2 reasons. The first is that she didn't have any confidence at all and she had a little bit of fear trying to go through knee extension. So having up on a bike with no resistance, going through a downstroke pattern was an easy way for her to know, to observe that things will be okay if she tried to go through knee extension. And it was the most pain-free way that I could get her to do that, to build her confidence. Now the second reason why I had her do this is to help control swelling in the knee. Now her knee wasn't swelling to a point where I felt it was necessary for her to ice it, but I wanted her to have some active means of controlling the swelling, and this was one of them. Now the third exercise that I had her do was functional knee extension exercise, and what I mean by that is that I had her get into a staggered stance, right leg forward, left leg back. She's holding onto a wall to support herself or a table. And what I wanted her to do here was to squeeze her bum muscle and translate her pelvis forward while trying to extend the knee here. Now I like this exercise for 2 reasons. She found it more tolerable to try to go through functional knee extension doing this exercise. Now the second reason why I like this exercise is because it is akin to how we walk in terms of getting a top-down driver to get knee extension when we are walking. So she took these 3 exercises home, tried them, and then 6 days later she came back for a second visit and we progressed things from there. Okay, so the first exercise that I gave her on her second visit was side lying hip abductions. Now with this exercise, I had her on her right side and then I had her to keep her left leg knee as straight as possible, left hip slightly extended, and then leg pointing towards the ground here. From here, I just had her lift her leg towards the ceiling and back within a small range, nothing too exaggerated here, going for about a couple sets of 10. I like this exercise for 2 reasons. The first is that it helps her maintain a certain level of glute strength since she isn't using her glute as much when she's walking. The second reason is that gravity doesn't have as much influence on her left knee extension here. So she found it a little bit easier to keep the knee in extension since she was in a side lying position. The second exercise that I gave her during her second visit was lower leg extensions while laying on her back. So while on her back, I had her prop a towel underneath the knee and then asked her to just lift her lower leg as best as possible and then slowly lower it. And like you may have guessed, I gave this exercise to her to induce a little bit more strength in her quad muscle as best as possible. Now before I saw her, Abby had seen some exercises online that she was doing on her own, and one of them was straight leg raises, but I had her hold off of this. And that's because her lower leg was lagging way too much, and you could tell that the quad was way too weak for her to be sustain this exercise. So I had her hold off of this and had her practice the lower leg extensions first before we proceed to the straight leg raises. The third exercise that I gave Abby during her second visit was being in a seated position and having her leg up on a coffee table. And then from here, I asked her to place something very light on her knee to try to facilitate a bit more knee extension while gravity was helping her in this position. For her, she could tolerate around 10 minutes, so I asked her to do that for about 10 minutes at home. Of course, as she built a bit more tolerance, I asked her to feel free to go a bit longer within her tolerance. The fourth exercise that I gave her was quite unique to her, but I'm gonna tell you anyways. So I had her stand against a wall and then asked her to keep her back in contact with the wall as best as possible, and with her heel as far back and as close to her heels as far back and as close to the wall as possible. And then from here, I asked her to try to straighten the left knee as much as she can. Now, I had her do this because I was noticing that whenever I ask her to straighten the knee in an upright position, that she'll go into lumbar extension to compensate for that. So I wanted to get true knee extension without compensatory motion. So this was an exercise that I came up with specifically for her. But if you're noticing something like that with you, you can feel free to talk to your physical therapist and try the same strategy if you would like. Of course, I told her to go for about a couple sets of 10 repetitions, trying to squeeze the knee into an extended position for a couple seconds, release, and then repeat again. Okay, now, so she comes in for a third visit. So we are using 3 out of 6 visits before her surgery now. So in addition to all the exercises that she was doing, I added on calf raises. So with the calf raises, I asked her to just keep her feet roughly shoulder width apart, narrow it if she's comfortable, and then go into calf raises while holding on to the wall, going for about a couple sets of 10 of them. Now, my focus here, like with every other exercise, was that I asked her to keep the knee as straight as possible while she was doing this exercise, while she was doing the calf raises. The second exercise that I gave Abby that day was functional knee extension exercises. I wanted her to be able to go through a little bit more left knee extension when she's walking with the cane. Now, if you're using a crutch, this will be a similar exercise, but the only difference is that you will have a crutch. So with the exercise, what I had her do was to hold on to the cane on her right side, step forward with the right leg, her non-injured leg, and then I asked her to take a moment to straighten the left knee as much as possible before swinging it to the right leg, and then repeating that cycle for about a minute. And this was to, again, get her to go through a little bit more functional knee extension, so to help her gait a little bit when she is walking with the cane. So 5 days later, we have our 4th visit, and that was over telehealth because she was traveling. Now, she hadn't had time to do her home exercises as much, so we went over all the exercises that she was doing, and then of course she had more questions specific to how she should take care of the knee while she's traveling. So we answered that for her, and then I saw her on her 5th visit. So 3 days later, on her 5th visit, Abby made a breakthrough. Do you remember the straight leg raises that I asked her to stop doing because she wasn't ready? Well, she was ready to do them now. Her quad strength has improved to a point where she was able to do straight leg raises while laying on her back for a couple sets of 10 to 12 repetitions without seeing an obvious lag. There was still a little bit of a lag, but it wasn't as obvious at all because her quad strength had improved quite significantly here. Now, during her 6th visit, 3 days later, she had achieved slight hyper knee extension when I checked her knee extension passively. So we also spent quite a bit of time talking about the things that she should do between the days that she don't see me after her surgery. So if this is something that you're also interested in, do let me know in the comments down below and I can share that with you. For those of you going through a similar phase, I'll be the first to say that this program is not for all of you. In fact, it will likely be a little bit different if I was prehabbing someone else to prepare their knee for an ACL surgery. I talk about treatment around specific profiles for this reason. But nonetheless, I hope this information helps you however you choose to use it. Happy healing. I would appreciate a like if you found this information helpful, and thank you for watching.